Hello. We're just going to have a trauma-informed conversation to enhance awareness and to encourage people to come on to our trauma-informed comprehensive trauma training that's coming up in September, then in December. So I'm going to start it off with introductions. Del, do you want to introduce yourself, followed by Mike, and then we're going to answer a series of questions.
Yes, hi, I'm Atkins. I'm a trauma psychotherapist. I do a lot of work at the moment in private practice with emergency service workers, and I've been working in the field, well, qualified back in 2009 and full-time been working in the field probably for the last 7, 8 years, and done in the order of around about 6,500 hours of client work.
Amazing. And Mike?
Yeah, I'm Dr. Mike Sims, trauma-informed psychotherapist. I teach out of Bar University, worked for many years in trauma and abuse and general psychotherapy and training as well. And yeah, it's me really.
Clinical supervisors, EMDR practitioners.
Oh, yeah. Oh, yeah, there's that too. Yeah,
Yeah,
yeah.
being really modest, being
I
really
forget.
modest. This
I
is
work
what
for the
happens.
NHS as well. Yeah, I forgot
Oh, I work for the NHS as well, so
that.
just throw that in there. And like Dale's, worked with sexual health, not sexual health, but sexual crisis work,
Yeah.
and sexual abuse and stuff like that. So lots and lots of knowledge. Myself, I
Experience.
lots of experience. I'm Jenna. I can't remember when I trained, but it was a really long time ago. I've worked in all sorts of different crisis points, specialised in adverse childhood experiences, and I'd say that the biggest partition of my work is probably working in complex trauma and EMDR trained. I'm a clinical supervisor to Motivate, Stop Domestic Abuse Service, worked in lots of difficult situations like human trafficking and child sexual abuse. And here we are all coming together to try and bring our knowledge, as a collaboration to put it out to anyone wanting to train in the arena. So I've got a series of questions. I'm just going to fire these out. Dale, you're in the hot seat first.
Not bad.
Dale,
Yep.
your professional definition of trauma, what would it be?
So I think it's really quite simple, and we're breaking it down to something quite simple. Is what I want to do is that my professional kind of definition of trauma is an experience that's happened to you, and it's your experience of an event. It's not the event itself, because often what we define and people think about trauma as is an event, something that's gone on and they've been traumatized by the event. And actually, it's not that at all. It's about your experience and your physiological kind of response and reactive kind of process that's come in to events that have gone on. And that can be massive events like wars, car accidents, sexual abuse, to small events like falling out of a tree, falling over as a child, experiences of what might be kind of viewed by somebody else as very small, but actually you can experience it quite large.
Fantastic. So do you think that we're where we need to be in terms of the definition from a clinical perspective when it comes to trauma?
I think from a clinical perspective, people that have done the training and understand, yes. But I think from the general kind of wider society, no, that I still get clients coming in at the moment saying, I've not been traumatized. And I'm sitting there, they've listed all of these kind of experiences that they've had and how they're presenting in the room, how they are finding life and day-to-day life in general. And actually, my understanding of what they're telling me is absolutely they've been traumatized.
Absolutely, definitely. So we're starting to maybe change with time in our understanding and awareness in that most of us as humans have a relationship to trauma, some greater than others, but adversity exists in this world. Anything you want to add to that, Mike, before I put you into the hot seat?
In respect to definitions or just what Girl's been saying?
Just really what Dale's been saying in the definition, like, and how your perception on it, like now, today.
Yeah, I mean, I think I agree with everything that Dale said. I think he's spot on. The only thing what kind of comes up for me is that we're talking about an event, but that event, what it tends to do, or way of understanding, is it shatters somebody's belief
Yes.
in their ability to exist in reality. So the event shatters a person's sense of trust, or it shatters a person's sense of security within their sense of reality. And like Dale said, that could be a variation of many things. But what
Yeah.
it does do, what the person takes from that is that I am no longer safe.
Yes,
I've
definitely.
experienced something that's rocked my world in a
Yeah.
way. Do you know what I mean? And from that, yeah, that then informs how they relate, perceive reality, and exist in reality.
Amazing. And I think that in terms of like the clinical timeline and what we capture on our training, and we do it, I think, in a really informative way, is that it's very much still in evolutionary phases of being understood. And epigenetics is a really good marker of that, because that's only really came onto the map, and it shows the pervasive nature of trauma and how it impacts intergenerationally. So what was a theme of being born with a blank canvas, what new research and clinical trials are showing us is that genetics can be transformed by the pervasive nature of reoccurring themes of trauma. So we're always learning,
Oh, definitely. Yeah, I think
always
you only have to
learning.
look. I think you only have to look at human history. You go as far back as you want to go. We've been horrific to each other. We continue to be
Yeah,
horrific to each other.
yeah,
We're violent, we're aggressive, we're abusive. And that creates trauma. That creates trauma on an individual, personal experience, but then it also creates collective trauma through a society or a
mhm,
species or a culture. And it's indicative to everyone. Do you know what I mean? It's ubiquitous to us all. I don't think any human being on this planet at this time can escape the historic element of trauma that has been in their generational lineage. It's just there. Be
yeah,
you black, white, Asian, whatever ethnicity, whatever gender, whatever sexuality or anything, it's present
yes,
at this
yeah.
time, more than ever.
Definitely, because we're so aware, aren't we? Okay, I want you both to answer this. We'll start with you first, Mike. It's a big one. What are the most complex themes that presented to you in your work? What is that, and what comes to the top of your mind? Most complex theme in working with trauma as a clinician, what is it?
I think it's an interesting question. That's going to put me on the spot. I guess the first thing that comes to mind, I think, is when you're dealing with, when the client is sitting in front of you, it's how much the trauma is informing how they see themselves
Mm.
and how they experience themselves and relate in the world. It's inescapable. I think that's what really kind of stands out for me, and the power of that, power of the event, the power of those continuations of the event, and the compounding of that. And, I sometimes see it with clients, and I say to clients, it's kind of like perhaps you were on this trajectory, and then you had the traumatic event, and then you were kind of like taken on this trajectory. Do you come back to this trajectory after you've healed the trauma? Maybe not, but maybe you come close to that again, or something changes. So it's how we get kind of shaped and pushed and kind of directed by the trauma, and sometimes that's in awareness, and sometimes it's outside of awareness as well.
Mhm. Mhm. Good answer. Amazing. Dale, what's your perspective on that? Most complex theme that you bump into as a clinician?
I suppose when I think about themes, I suppose just picking up on what Mike said there as well, what I hear him talking about is just the depth that kind of trauma has, and the fact that it's so deeply kind of embedded within every interaction. And then when I think about themes, I actually think about kind of relational trauma, and how trauma actually, the depth and that kind of the element of embeddedness, it will affect relationships going forwards with every person, with every situation. And I think often relationships are so important. And when we talk about relationships, we often think about kind of significant other partnership relationships. Actually, when I think about relationships and I talk about relationships, I talk about all sorts of relationships, relationships with
Yes.
significant others, with friends, with children, with organizations,
Yeah.
with work, with
Yeah.
society, with yourself.
Yeah.
And actually, the depth and level of that kind of impact is huge. But then when we talk about complex themes, childhood sexual abuse is a theme that's incredibly complex because of the relational dynamics within it. You can be hurt by the person that you need there to keep you alive.
Yeah.
So you've got this push and pull kind of process that's really kind of coming in. Other elements around complexities is things like moral injury.
Hmm.
A lot of kind of emergency service workers going into situations having to make split-second decisions or kind of decide to, do I deal with this person? Do I deal with this person?
Yeah, definitely.
Similarly, kind of war veterans, and those are extremes of moral injury. We can experience those moral injuries kind of as an what might be defined as an average person, an everyday person.
Hmm. Hmm.
How about yourself, Jenna?
I'd say that because most of my work has been working with like even in adult clients, I'd say, childhood adversity. And I think that with children moving through high degrees of adversity, and when it's on repetition, I think it's the harm that's done to, again, the belief system, the mind, the ability to regulate emotion. And it's not every case, but in lots of my cases, I've got disassociation, detachment from self, and then I've got this normalization, which I'd say is the most sinister part of all of my work, where people are in these really diabolical situations where there's prolific, levels of abuse and violence and toxicity in their world, and they're so used to it and they're so numb to it, and they've got cognitive dissonance, and they just accept it until we begin a process of saying that should never have been done. It should never have looked like that. And they're in survival mode and they're learning how to just feel a measure of safety. Does that make sense? And it takes
Mm.
time. That takes a really long time.
And that's the thing, isn't it? Is and actually, when I hear you say survival mode, actually, I don't think it's a mode. I think that that's an existence.
Yeah.
It's a
Yes.
shift within their existence,
Yes.
within their interaction with
Yeah.
everything in the world.
Yeah, yeah, and there's no for some people, and I think the thing that we need to understand as professionals, for some people, for some of the children, the looked after children I work with especially, there's no room for them to thrive.
Mm.
There is nothing there to give them the conditions to thrive. So they're just in this space of getting through as best that they can. And I think they're not rewarded enough by our understanding and trauma, and that's the education system to say, my God, look at your resilience and what you're capable of, in terms of getting through hardships. Does that make sense? Yeah.
Absolutely. And I think this is where it kind of teeters into societal elements as well, because it's environmental. So, certain people live in a certain environment, in a certain class, or have certain financial kind of, privileges. Some people don't. That's going to have a massive bearing on how you perceive life and your ability to build resilience and robustness, but also be affected by trauma. So I was a child of the 70s. I spent most of my time out on my bike as a kid, in the 70s and 80s, and on housing estates and all that kind of stuff. Fights, violence, racism, sexism, homophobia was just a given. You know what I mean? It was around everywhere. People were fighting, people were being abusive, not all the time, but most of the time. You were in survival mode. You know what I mean? So that environment had a bearing on those children that grew up on it. It had a bearing on those adults that were existing in it. Do
Yeah.
you know what I mean? So that they were experiencing trauma pretty much on a day-to-day level, micro traumas and major traumas. Do you know what I mean? So I think, and whereas some people perhaps were, more middle class or they had more privilege, they weren't being subjected to same levels of violence or same levels of abuse. Maybe they were in different ways. So just understanding your environment on a social context and how you're positioned in your reality has a bearing on how you engage with trauma and your
Yeah.
susceptibility to receiving trauma as well in that sense. So I think, that's a really important thing to understand. And I think when clients come to therapy sometimes, they're not aware of the impact of that.
Mm.
Yes, I had a car accident. That was
Yeah.
horrific. Oh, yeah, I can feel the trauma of that. But what was your childhood like as a kid? Oh, it was all right. Dad was a bit this way and mum lost the shit now and again or whatever. But, and I used to fight with my brother, but, it was generally all right. Was it? Do you know what I mean? So it's not until clients come to therapy sometimes that they start to kind of disentangle themselves and start to realize what levels of trauma that they've existed on throughout their life.
Definitely. Definitely. And sometimes that profile is so very extensive, isn't
Oh,
it?
absolutely. Yeah, yeah.
Next question. What's the best advice that you can each give to anyone beginning a career in this domain? This is a great question. I can't wait to hear your answer. What's the best piece of advice to anyone starting their career in this domain?
Well, Dal, you take this one to begin with.
Well, there's two initial words that kind of come up into my mind. One is self-care, the other is training.
Yeah,
Just
reality. Hmm.
fill in the training, do as much training in all sorts of different areas. The list of kind of CPDs that I do kind of every year, I love it, I enjoy it, but I take something different from all of the different trainings that I go to. And actually, I am the clinician that I am now as a consequence of every single one of those trainings. Some more than others, some less than others, but actually, it's all of that information and bringing me into that space and kind of how I see things,
Yeah.
and my personality. But self-care, massively important. I've been close to burnout on a couple of occasions, and
Mhm.
it's something that I have to regularly monitor.
Yeah, definitely, because it's incredibly difficult to work in this area. And I think that's one of the things that I like to pop the bubble of anyone, and I know that it sounds really interesting, but the context of holding space and being an anchor to someone
Mhm.
moving through extreme degrees of trauma is very, very hard to do. And it takes us time to get there.
Yeah,
Mike,
definitely. So
what's
I
what's
think
what's the advice?
ask yourself why you want to do it.
Mm.
Oof, oof.
Know why you want to
Mm.
work in this field and what's motivating you and driving you to do it. If you can answer that coherently and congruently, and you understand yourself and why you're doing it, then that's a good starting place. I think a lot of people come into this field, and there's no disrespect to them, but they come in for the wrong reasons. They come
Yes.
in because they want to save themselves. They come in because they want to resolve situations and heal their own trauma, or they want to save people or save the world, which is wonderful. But it's not actually doing the job
Mm.
properly because you're getting in the way of yourself and you get in the way of other people. So they always saying about self-care, but what I would add to that is self-awareness. That's
Yeah.
the key to begin
Yeah.
with.
Yes, so that you maintain an ethical standard of working from their frame of reference rather than working from a space that's unhealed inside of yourself, because it
Absolutely.
is.
And if you get
Yeah,
good training, like Del was saying, and you get
yeah,
yourself onto a good
yeah,
course, that will be in there. That will be integrated into your
Mm.
training, and you will develop the awareness.
yeah, definitely. I think as a side note, what I'd like to add to what you've both said is anyone beginning this career path, I think that it's very much for me at this point, I really had to earn my stripes. There was no way that I came into this sector having,
Yeah.
the knowledge that I have today. I had to evolve as a practitioner, go into CPD, and then also manage myself at crisis points. And similar to Dale, I was in situations when I worked in human trafficking. It was probably the most vulnerable partition of my whole career. And we are human beings, and it on levels destroyed parts of me because it was so difficult to hold it. And I
Mm.
think it really is blood, sweat, and tears go into these pathways for all of us. It's absolutely not easy. And I don't think ever come into it thinking that it is because you're interested in it. It takes a
Yes.
lot to be good at it. Does that make sense?
Mm.
Yeah. Oh, yeah. I've seen a lot of good practitioners fall by the wayside when they start to step into the trauma world
Yeah.
because of the complexity of it, and
Yeah.
because it's so, like Del was saying before, it's so deep in us.
Mm.
It's
Yeah.
so deep in us. So you've got to really understand yourself and know yourself
Yes. Yeah.
before you step into this field,
Yeah.
because it will shake your foundations if you're not careful.
And
As you
some.
both as you both know,
And some. Yeah, I remember thinking, and I talk a lot about it in clinical supervision to some of the staff that I supervise. Your worldwide view adjusts, you work with the underbelly and the undercurrent of what most people, in the average day-to-day life have absolutely no awareness of, and you see it every day, so we need to
Yeah.
expect that it's going to have some level of impact.
Yeah.
Oh, absolutely. Yeah, this is the news and Netflix in reality.
It is, yeah, it really is. And then I watch these bloody documentaries in my free time, so I don't know what it says about me. Okay. How do you both manage vicarious trauma in those really complex cases where you are anchored into the darkness, walking the path of trauma with your clients? How do you manage it when you leave? What's your self-care strategy? I know the answer to this, I think, for both of you, but indulge.
If you know the answer, then you tell us first.
No, one bloody not. You say it. You go. You tell people.
I think that the strongest thing for me when I think about that is boundaries. I've got to maintain boundaries. I've got to maintain the fact that, okay, if I'm agreeing to kind of work this time to this time, that's the time that I work in. Outside of that, I'm not.
Yeah.
Yeah.
Outside of that, I'm connecting with other people. Doing stuff by myself that I enjoy doing. I'm doing the jobs that I need to do that give me a sense of achievement. Actually, I suppose kind of managing that vicarious trauma, it really keys into that self-awareness aspect of things. It keys into that, okay, well, what do I need to do today? Do I need to just sit and mong out in front of the TV for the day? Um, or do I need to go out, do some exercise, do some tasks, go to the gym, get out on the motorbike, whatever it may be?
Yeah.
Mhm. Mhm. Mike, what's yours? What's your thing that you use to help you manage it?
I think what I've developed over the years and realized is that, and I'm sure you both know this, is that, this is not martyrdom. This isn't a place for sacrifice. This is a place where you have to be 100% caring for yourself.
Yes. Mhm.
That is ultimately what it's about. And if you don't believe that you can do that or are worthy of that or deserve that, then you're going to leave yourself open to burnout and vicarious trauma. And that's not about being self-centered. That's not about being selfish. That is really about understanding the value you have as a human being. And if that is working at its optimum prime, then you can offer that to other people. But if you're not functioning at your best, then you are of no use to anybody else. So it's you have to, like Dale says, it's boundaries. You've got to keep those boundaries in place, professional and personal boundaries. And if you can't do that, then you need to go and learn how to do that, you know, because you will just get swallowed up by the beast of vicarious trauma if you do not. And it's not a pretty picture. You've got to.
Yeah.
So it's boundaries for me. Like Dell, I make sure that I do the things I enjoy, so I get out in nature, um, hang out with my friends, with my loved ones, have time to myself, meditate, just do all those things that enhance me. And anything that takes away from me or has a detrimental effect on that, then I'm very boundaried around how I manage that and how I engage with that.
Good. Good answers. Amazing. Incredible. I'm going to ask one more question because I feel like we could talk until the cows come home because we're all, you know, really, really passionate about the field. Okay, I think me and Dale spoke about this one earlier, so I think it's important. Uh,
Mhm.
what's the most useful tool, in psychological education that you use as part of your practice? I know that there's so many and that we share so many as part of our training, but for you, what's the one that you really use the most?
It's as we mentioned kind of earlier on, actually, there isn't a specific tool that I use from a psychoeducation perspective. I go through with probably 95% of my clients I will go through psychoeducation. It's a standard kind of format of various different things about kind of the brain development, how the brain functions, how the body functions. But I think really kind of a takeaway element around psychoeducation is around I think about human beings as three elements to us. What we're thinking about, what our thoughts are, what our cognitions are, what our feelings are, and what our body experience is, what our physical sensations are. And I think for me, getting a sense of integration and balance between those three areas
Hmm.
is probably key.
Yeah, definitely. Taking back your power from the
Yeah.
trauma. Yeah.
And it's not an easy thing to do, and it's not a
No.
5 minute job.
No, and it's not, and it's also not something there's a quick fix solution to that because I think that I think one of the most imposing features that and one of maybe even the ethical dilemmas we have in therapy is that sometimes we need, people want quick results. And I think that when we have really complex themes of trauma, it's impossible to do that because we cannot expect that people will feel safe enough in these really short time frames to open up what they need to learn about themselves to get to a space of safety with you as a therapist and then inside of themselves. So yeah. Yeah. Mike, what's your tool or tools?
Well, I think I kind of agree with what Carl was saying yourself. I think for me, it's helping the person value themselves.
Yeah.
That's the tool, and understanding that, like Del was saying, it's complex. This isn't a quick fix,
Mhm.
and you know, trying to help and also learn from their own experiences as well. Draw on their experiences to educate themselves and help them see whatever we're educating them on from a psychoeducative perspective, putting it in their terminology so they understand it. Some metaphors from kind of their reality or how they see it. Do you know what I mean? Being able to kind of communicate in that way. I think that's probably one of the tools I use the most is kind of help people assimilate. Don't always get it right, but I try, to kind of see it from their perspective and help them understand it from their world. Do you know what I mean?
Definitely, definitely. I think that when we deliver the training as well, we've got a tool manual to enhance the professional frame of reference so that you have the tools of psychological education to understand, help people in understanding themselves. So it's more about a human experience rather than some of the things that come up quite often in therapy is that people think there's something wrong with them. But when we show them through psychological education that they're having a human reaction to a threat in an environment, and when they get to learn that, they feel less like it's a issue with themselves, more it's a response to something that is human that I'm not okay with.
Yeah, it's a kind of normal human response, isn't it, to an
Yeah.
adverse situation?
Yeah, yeah, and learning that there's because I think quite often when children take everything personally, and I know that Gabor Mate does a lot of work in and around, that kind of statement and that place that we land to and circle to when we hold ourselves accountable for like some of the really abuse that's been in the environment when children, it's never their fault. And I'm saying this really like I say it a lot because I still work with children. That's not your fault. You don't deserve that. Don't deserve that to happen to you. And then renegotiating like an awareness so they can have like a ethical way to move forward in their world as they age and move through time that's not entangled in abuse and trauma. So,
Yeah, absolutely.
well, thank you. Anything else? Do we want to add anything else to anyone that's going to watch it about anyone that's thinking about coming on our training? Anything else we want to say?
Well, I think as you mentioned kind of earlier on, we could all sit here and we could probably sit and have a conversation for about 4 or 5 hours just talking about different elements and different aspects of kind of trauma and relational kind of processes that are going on. I think what you're saying there about a sense of responsibility that kind of clients often feel and how that can shape themselves and interactions with other people is huge just in itself.
Yeah, and
Yeah.
shame, the
Mm.
shame that comes. And that's one of again, when we share this on the trauma training that we deliver, there's a tool that we have in around dismantling shame so that we get it out the way and we can move and process the trauma underneath it because it sits on top of it quite a lot of the time.
Definitely. Yeah. I think a thing that kind of really jumped out at me was one of my clients actually, and I think just be aware of resources as well. She read this resource. It's a great book, Body Keeps the Score, but she was under the impression that this person had about 2 or 3 sessions of EMDR and she was sorted. So she thought, I'm going to have a couple of sessions of EMDR. And then, this is coming from a person that had had horrific, historic sexual grooming and abuse from all the way through their childhood. And she thought, like, well, in the book, she had a couple of sessions and all that trauma had gone. So just be aware that actually that, literature is amazing and the resources are amazing, but sometimes it doesn't actually give a very clear message about actually what it takes to engage in the healing process of all this. And, resources are good, but it will never replace being and doing the work with a real practitioner. If you want to get through this, you've got to actually invest your time and your money, and yourself to actually working with somebody that can really help you along the way, you know.
Fair. I think it's a really good closing statement. Thank you for doing the interview. I don't know if that
Pleasure.
was an interview or more like a promo for our training. I think it's a promo for our training. Any questions around our training, please email me. And we've got a virtual training days coming up in December, and we'd love for anyone to join.